their voice and speak up for themselves. And we are here to be their allies and speak up for the mental health and the people at the center of the mental health in the next policies, in the next politics of the EU Parliament. So in a nutshell, I wanted to say that we are really, really concerned in UFA to make the case of mental health in the next EU Parliament, to have a mental health commissioner, and to do nothing for the people without the people. So we're really much looking forward your insight after this day, after this week, and in everything you do, so that in the next 5 years, we do a real change and we have a real impact. Thank you very much. And over to you, Lydia. Have a great week, a great meeting.
Thank you, dear Charlotte. This was Charlotte Merchandise, the UFA Executive Director for the European Public Health Association. Thank you so much for being consistently putting mental health at the center of UFA's efforts. This is not the first time that UFA has focused on mental health during the Public Health Week, so much appreciation. Good morning, everybody. I'm Lydia Lazari, the Regional Advisor for Mental Health here at WHO Europe, and I'm joined in this table by Jason Morer, my colleague here at WHO Europe, who is responsible for mental health communications and advocacy. And I'm very honored to be joined today by an illustrious panel that to start with Catherine Brogan from Mental Health Europe, who is the co-host with UFA, WHO, and the European Commission. I'm also honored to be joined by Jutta Lindert, that in addition to being part of the UFA Public Mental Health section, she also represents here today the World Federation for Public Health. Thank you. Good morning, Jutta. Then I am joined here today by Gulnara Sagieva and Aygul Shakibayeva, both of them from Kazakhstan, and they will share their stories about co-creation. Then Regina Bisikiewicz from the Polish Institute of Open Dialogue. She joins us from Warsaw. Then we are joined by Gina Delaney and at Mental Health Ireland. Gina joins us from Dublin. Then Dion Ras and Ines Sarmento, who are our young members of the Pan-European Mental Health Coalition. They join respectively from Portugal and the Netherlands. And last but not least, we have Stefan Schreck, who represents DG Santé from the European Commission here today in Brussels. So you see, we are truly a European gathering today, and we can see from the names of our attendees that our representation and reach and dissemination is truly European. Now, this session today is dedicated to co-creation, and we try to see co-creation as a right, as a human right. And Charlotte reminded us about how citizens use their rights to make things better in their life. And this is the guiding principle about co-creation is indeed that it is a right of all those who in one way or another are involved into receiving mental health services, are involved with shaping mental health services, are involved with shaping mental health policies, and so on. So when we are talking about the rights of people and how those who are in positions that are held accountable, such as policymakers, leaders, etc., elected leaders, then we have to talk about, okay, approaching it from the rights perspective is one end, but the other end is also, does it work? Does it work? Does co-creation work? Is there evidence? Do we know whether it has worked before? Do we know, can we predict whether it will work in the future? On those and more, we are going to talk today and all the colleagues that I mentioned are going to give us their insight and experiences. But before we go to the panelists, I would like to start with a poll that is now showing in your screen, that please take 1 minute to respond to the question. Yes. What does co-creation mean to you? If you kindly give an answer to that, we will be very happy because it shows us where do we start. And while you are responding to that, may I remind you that we will need to use a couple of housekeeping rules. We will need to use interpretation at a certain moment in this session. And you'll see in the bottom of your screen, you have a button that says English. So when there will be a moment when the Russian language will be used, please use that button for you to be able to understand what the speakers will say. And the other housekeeping rule that you are aware, but I'm reminding, is that this session is being recorded. And by participating here, you have accepted to be for the session to be recorded. Thank you. We are having more and more answers. So we're giving a few more seconds to allow more attendees to respond. Thank you, thank you. Keep the answers coming. That is co-creation, actually. The more you respond to that poll, the more co-creation becomes a reality. So I'm not yet giving the floor to Catherine because I hope to have all the 124 participants giving an answer. Okay, it seems we are, yeah, okay, some more. I'm going to 2 minutes. I'm going to the mark of 2 minutes.
We can leave it on as well.
And we can leave it on. So thank you so much to all the 63 colleagues that have responded. Keep sending your answers. We are now going to our first speaker, that is Catherine Brogan from Mental Health Europe, that will talk about what is co-creation. Catherine, the floor is yours.
Thank you very much, Lydia, and thank you very much for joining us here today for one of the many events that are taking place across this week of European Mental Health Awareness Week. And today has been co-created by the European Public Health Association with the World Health Organization Regional Office for Europe, Mental Health Europe, and the European Commission. So how do you do co-creation in mental health is the title of today's event. And before I go into that, I just want to give you a little bit about who Mental Health Europe are. So we're the main independent European non-governmental organization, and we're committed to the protection of the rights of people with psychosocial disabilities, the promotion of mental health, prevention of mental distress, and the improvement of mental health care and social inclusion. We're a membership-based organisation, and there are over 70 organisations across 30 European countries now members of Mental Health Europe. And we couldn't do the work that we do without the strong support and the participation that we get from the members, because the team is quite a small team. Back in 2021, we co-created and launched our strategy. If not now, when? And in that, we identified a number of key priorities around mainstreaming of a human rights-based approach to mental health, implementing the psychosocial model of mental health, achieving accessible, high-quality, recovery-orientated mental health services in the community, and tackling mental health stigma and discrimination. All the while underpinning that by ensuring that we have true co-creation. That means having people who are expert by experience, their supporters and family members, people who work in the services, people who work in policy, decision makers, and any other people, stakeholders across the different perspectives that need to be involved in co-creation. You may know already that Mental Health Europe is the home of European Mental Health Awareness Week. And this is a pan-European initiative that raises awareness around the whole area of mental health and also around reducing the mental health stigma. It's in its 5th year now, and what I can say over the last 5 years is it has just gone from strength to strength. But we always need your help. So if you can log on to the Mental Health Europe website, and if you can have a look at all the events that are on over the week, and please, 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 can you share them on any of the communication channels that you use? By you doing this, you are also supporting co-creation in a virtual way. So co-creation, it's a lovely word. In Ireland, we use co-production. And some of you may know, similar to the word recovery, it can get overused and it can be used without really understanding what exactly it means. So what we want to do across Europe is have a consistent approach. And in order to have a consistent approach around co-creation, what we really want people to know is, what does it mean? And I am really excited to see what's coming in on the channel from the vote around what it means to you. So if you were to look at elements that are involved in co-creation, what would they be? Well, the first thing is that it's a collaborative process to ensure better mental health for everyone. It's about trust, it's about power sharing, and all of that is based on the recognition of the expertise and the diverse perspectives. So you're looking at people who have lived and have living experience, they're supporters, professionals, and decision makers. It's about being, but more importantly, feeling equal in the process. It's about being listened to and having your voice valued for what you say. It's about sharing ownership, responsibility, accountability in decisions that are made, but also it's around implementation of those. It is based on mutual respect. And yes, I can 100% tell you co-production or co-creation is messy. And if it's a thing that it's not coming across as being messy, then it's not being done right. Because when you get a lot of perspectives in the room, you are going to have to work around sharing the learning, listening, learning from people, so that then you can get the best decisions out of that. A lot of people would say, oh, but it takes more time. It doesn't actually. It takes more time in the planning of it. But when you work in co-creation, you will get what it is people need as opposed to what we think people need. But it is easier said than done. And that's why last year, members of Mental Health Europe, supported by the team in Mental Health Europe, working in co-creation, developed the guidance document and the toolkit, which is dedicated to supporting any organisation across Europe who wants to begin their journey on adopting this way of working. It's a living document, and it will continue to evolve and change as we advance the co-creation process. The links will be dropped into the chat by Jason, and that will make it easier for you to access all of that. And I'm only going to go into one facet of it, and it's something that I want you to start thinking about based on what you're going to hear from the panel around the questions, but also what they're going to present to you around their experience. So there's 7 principles of co-creation. When it comes to inclusivity, first question to ask yourself, are the right people here around the table from the get-go, from the outset? If be that in relation to policy development, a research project, a service development, a program. Equality. What does equality actually mean? Is everyone's perspective being acknowledged as essential? And are we acknowledging the experience, the expertise, the skills, and the insight that everyone brings to this process? Ask yourself around respect. How are we going to demonstrate respect in a constructive manner when we work together? Reciprocity. How will we genuinely share our thoughts and our feelings about the experience we have as a group? Where we get that mutual learning, then we will get shared meaning. The sharing of power. You need to recognize that different areas of expertise so that then we can have a result that you have shared ownership, a democratic shared ownership of the process. Accessibility, and this is a key piece. It's really important that we have equal opportunities to participate and contribute to this process. And that means taking a look at resources that are needed to make sure that we can get everybody who has a voice to contribute to this into the room, including financial support. And transparency. The whole process is jointly and clearly outlined and understood. And that means there are no sidebar conversations. There are no meetings before the meetings. The meetings that are held together in unison. But co-creation is a process. It takes time to learn how to do it and to get comfortable with it. It'll challenge you. It will involve changing how we perceive our roles. It can be frustrating, and at times you will question yourself around it, but I can 100% guarantee you that if you adopt this way of working, you will see real change in the outcomes for those who use our services, the supporters of those who use our services, service providers, academic, researchers, and policymakers. And in conclusion, and it was said by Charlotte, this is an election year. We have a voice. We have an opportunity in all our countries to come together with agreed asks, have our voice raised and heard about mental health, human rights, discrimination, and stigma. Thank you.
Thank you very much, Catherine, for bringing your perspective on that. And if I can also highlight the way how you introduced co-creation to us makes clear that it is indeed a very innovative way of approaching how to do things in mental health, because the traditional way, it's very conservative, rather, it's very paternalistic, and Guadalupe has put in the chat that the paternalistic way is not co-creation. So we are moving away of that conservative, paternalistic way, going towards co-creation as a refreshing, as an innovative way of doing things better and doing things more. With many thanks, and I'm sorry, I'm sure that many people would like to applaud, but I can see that the applaud function is not there, but accept please an applaud from this end here. I'm going to our next speaker, who is Jutta Lindert, who will give us, she is an academic and she's very close to mental health. Jutta and us have met in different meeting points, and now Jutta is trying to give us a context about co-creation. Over to you, Jutta.
Sorry, I was on mute. So thank you very much, Lydia. It's a real pleasure to be here with you today, and especially because I founded many years ago the UFA Mental Health section. So I'm very, very happy about this webinar, having founded the section from the scratch with very few members within UFA, and now we have such a wonderful webinar. So thank you for organizing, for co-organizing. It's really a pleasure. We are talking today about co-creation and about co-production. And one of the reasons is that the professional knowledge and the experiential knowledge might differ a lot. So as an example, I looked into some notes from a famous book from O'Hagan, contrasting the clinical notes with the personal notes. And I'm just going to quickly read it. So the clinical notes read lacking motivation, sleep and appetite good, discussing etiology, medication levels next time. And at the same time, the experiential knowledge notes everything hurts. I want to die. I saw the doctor. I said nothing. Nothing seems good. So we can see here quite impressive that the clinical perceptions and the perception by the patients or end users might differ a lot. But psychiatry and the public health and the public mental health system since many years are trying to change this view and are trying to change the world how psychiatry is perceiving patients. And psychiatrists around the world have been involved in the suppression of individual rights since many years by states in which the definition of mental disease had been expanded to include political disobedience. So, psychiatry and the mental health system has an inbuilt capacity for abuse, which potentially is greater in psychiatry than in other medical specialties. Therefore, I will give today a very, very brief overview on some paradigms which feed into this paradigm of co-creation, and then I will speak a little bit about effectiveness and research and potential next steps. So first of all, maybe anti-psychiatry is something you all are aware of. It is an international movement that emerged in reaction to Nazi psychiatry. And as I am from Germany, so I'm specifically interested in this history of psychiatry. Under the Nazi regime alone, 200,000 patients in psychiatric care were killed by the Nazi regime. And as a reaction, anti-psychiatry evolved. Basically, with some specific views that psychiatry may be, in some cases, an instrument of oppression. And anti-psychiatry was strongly against this instrument of oppression, and some famous names are involved into this movement of anti-psychiatry. And especially the involuntary commitment, which can be enforced legally, was a very important issue in this movement. Furthermore, the recovery movement emerged. Recovery movement means that personal accounts of mental illness count, and we can learn from these personal accounts, basically, and that mental disorders, mental health conditions are not chronic conditions, but there are potentials and opportunities for recovery. So this is the next paradigm. And the third paradigm is the trialogue movement. The trialogue movement as well was established in Germany, which means a communication in trialogue groups, a communication in which clinicians, patients, family members meet in an open discussion. And by meeting in these open discussions in the trialogue movement, we tried, and they tried, to overcome the clinical routine with this power imbalance, which already has been mentioned, because the power imbalance and the right to define what are symptoms was identified as one of the main obstacles in recovery. So the concept of trialogue groups basically is a specific form of communication between service users, family carers, and mental health workers beyond role stereotypes and beyond power imbalances, which means an active involvement, and for the first time ever, a real active involvement, including family members and friends, to promote mental health recovery. Then we have this new paradigm, or it's not anymore so new, of co-creation and co-production, co-design, which has been mentioned so nicely by Catherine. This basically comes from a business model, which means that now this concept of co-creation is standardized, and it is even ratified under DIN norms, including a human-centered design, which means that the active and committed decision making means a meaning through respectful interactions and dialogue where everyone's voice is considered. However, it does not come from the field of medicine, but this paradigm of co-creation comes from enterprises. And basically, one of the first enterprises to use this concept of co-creation was Lego. So Lego Ideas was founded and launched in 2008. And this concept allowed users to submit ideas for Lego products to be included into the production, and the original designer who submitted the ideas received 1% of the royalties in case Lego started to produce. This means basically co-creation is a business model. And maybe we have to think about how we can transform the business model into a caring model. Which means basically co-creation at the moment is defined as a shared body of usable knowledge across scientific, governance, and local practice boundaries, which includes scientific resources, governance capability, and adaptive leadership. This refers both to the business model and as well to the model in caring. So we have a lot of co-approach activities, and here I brought you a slide from a publication by Grindel, which identifies some of the cornerstones of co-creation with the aim of finally improved health outcomes. Because at the end of the day, the aim of co-creation and of the anti-psychiatry, of the recovery movement, and of the trialogue paradigm is that the patients and users have long-term improved health outcomes. So from a scientific point of view, and I would like to wear this hat today, I'm asking for effectiveness. So for the effectiveness of the different approaches, and there we still have a lot to learn about effectiveness. I did some searches in PubMed and in the scientific literature, and there is some evidence that indeed co-creation contributes to better mental health, especially looking at those with perinatal depression and for those with severe mental illness. Especially effective is the concept of co-creation for satisfaction with care. However, all the literature suggests that there is a need for further research to evaluate the long-term outcomes of co-produced community interventions, and basically only 2 interventions are based on research, suicide prevention, and substance abuse. And therefore I did a search. I was wondering, what does the literature tell us? And this is an updated PubMed search from yesterday. We can see that the literature on co-creation is growing, and that we have now in 2024, indeed, we have a growing evidence and a growing interest in research on mental health and co-creation. What can co-creation contribute to better outcomes? What the literature tells us is that co-creation contributes to informed choices in case it is done in a nice way. It has a focus on recovery and of healing. and it is person-centered and less clinician-centered, and it at least it tries to establish a partnership between end users, patients, providers, and stakeholders. So by co-creating, the theoretical literature shows that it's at least an attempt to overcome the paradigm of them and towards us. So indeed, it is an attempt of mental health by involving everyone. But we need some more outcome research. Outcome research means what works for whom, under which circumstances, and for which diagnosis at which age. So there is still a lot to learn about the specifics of the intervention and how we can indeed improve the long-term outcomes in the field of mental health. Therefore, maybe in the future we can answer some questions, maybe next webinar or in 2 years. So maybe we will be able to answer what are the short, medium, and long-term outcomes in case we are applying co-creation versus traditional approaches to mental health care. Do these outcomes differ by diagnosis? And there is some evidence that indeed the outcomes differ by the diagnosis. And how can we adapt the scientific methods to this concept of co-creation? Because indeed it is very difficult to do a sound theoretical, a sound scientific research. Do trajectories of outcomes differ by diagnosis and by gender? Because this is another question, because of course we are interested in the long-term effects. So how do people live in 5-10 years with the diagnosis, and how co-creation and other attempts to improve psychiatry can contribute to positive long-term outcomes? So thank you very much for this opportunity to give at least some attempts to better understand the scientific perspective of co-creation. Thank you.
You're on mute, Lydia. You're on mute. You're on mute, Lydia.
Apologies. I was saying a lot of praise to Jutta. Thank you, Jutta. I suppose other people are uploading your introduction now. The two of them, among the very valid points you made, I'd like to pick two. One is how we phrase the discussion about co-creation. We see go to meetings, go to events, and still the old narrative, them versus us, is still the narrative of we need to allow, we need to bring, we should focus on. It's very clearly that in the mind of many, the dichotomy between people who make decisions and people who are at the receiving end of these decisions are still into different trenches. So thank you for reminding us about the need to change that narrative. And also a very good point was your question, what works for whom? And that reminds me, at my start of this work I'm doing now, I started with WHO in 2000. And at the time, the narrative of the efforts for deinstitutionalization, etc., was that the services, the traditional services, were built upon around the institutional needs. So what's good for the institution to have a certain success rate rather than around the person needs. So the question is still valid today, as it's confirmed by your presentation. So now we are going, without further ado, we are going to our very interesting panel that will focus about how has co-creation in mental health been done before. Now, I understand that our first speaker, that is Gulnar Sagieva from Kazakhstan, she is having some difficulties with translation, but I want to check if our translator can please speak Russian now to convey to Gulnar that we are expecting her to take the floor and talk us through how can one regain their
Да,
rights
я
in
слышу,
Kazakhstan.
уже все наладила, успела. Здравствуйте, да, успела уже
Excellent.
перевод сделать. Здравствуйте,
Fantastic.
меня зовут
Gulnar,
Гульнара,
the
я
floor is
из
yours.
Казахстана.
Over to you, Gulnar.
Спасибо большое. Я рада, что здесь я побывала. Я надеюсь, что я вам информационно, может быть, какую-то принесу пользу, или вообще моя история, может быть, понадобится кому-то, будет пользой для того, чтобы не попасть в такие ситуации. Поэтому я рада быть здесь. И мне на сегодняшний день уже почти 50 лет, без 5 минут. Но на тот момент, когда я попала в клинику, мне было 29 неполных. И, в общем, сама суть в том, что когда я попала в клинику, тогда у нас в то время еще мало кто занимался этой психиатрией. То есть, в смысле, в том плане, что я увидела первое, что как медик, потому что я бывший медик, я проработала почти 10 лет в детском отделении. И, как обычно, я привыкла, когда врач там решает вопрос, там, например, ведет беседу и назначение делает только после каких-то определенных, но я попала в другую ситуацию, когда меня уже привезли бригадой и так далее. Здесь я бы хотела сказать, вот знаете, что, когда вот оказываешься между двумя дверями, то есть между родственниками, тех, которые имеют право привозить человека в психушку, там, потому что в любом другом месте, любой другой человек не имеет права на это. Даже если он будет считать обоснованным свои действия, его обоснованным никогда не принимать. То есть здесь у человека играет только два роли. Либо за тебя решает родственник, либо врач. Но одновременно эти два звена, они взаимодействуют, друг без друга не могут в отношении тебя, то есть как больного человека, говорю. Поэтому у меня возможности, например, снять диагноз не было. Оснований, например, то есть для того, чтобы, допустим, сдавать полицию, их, например, писать полицию заявление, там, например, жалобы, что на меня, там, например, это, там, тут тоже не было смысла, потому что здесь, как бы сказать, больше слушали тех, кто тебя туда привел. Тут вообще самая сложная ситуация, это когда ты попадаешь в то состояние, когда начинаешь делить плохих, хороших, или вот когда для тебя есть что-то, поступок какой-то, ну вот это вот зависимость какая-то, определенность. Определенная, когда появляются страхи из-за этого, потому что ты за будущее свое переживаешь. И это когда уже тот социум, когда ты уже начинаешь взаимодействовать с людьми, то ты, получается, как бы оказываешься в каком-то детонаторе, потому что ты, их взаимодействие с тобой и твое внутреннее состояние, оно реагирует. И до тех пор это было тяжело, пока я не осознала вот это вот все, вот это состояние, и начала управлять этим состоянием. Просто, например, эмоционально и физически, и в действиях, и вообще в поступках я прежде всего, там, например, сказать слово, я уже начинала думать. То есть как бы получается восстанавливать свой собственный внутренний баланс для того, чтобы понять, что происходит вокруг. И тогда уже появилась вот такая вот, как вам сказать, тогда уже появилось вот это вот желание что-то изменить. То есть в этом, независимо от того, что ты там, что случилось, да. Ну, немного поздно, потому что уже как бы получается вся вот эта твоя вот жизненная ситуация, когда ты не свободна, ты не можешь принимать решения за себя, это очень тяжелое. И весь Google я там просмотрела все это, как это все делается. И тогда я пришла там, помимо всего остального, есть очень много препятствий, потому что тоже опять входит в рамку в зависимости от структур, в рамки в зависимости от настроения или решения родственников. И поэтому, получается, тем не менее, вот я просто отпустила эту ситуацию, стала жить просто обыкновенной человеческой жизнью. Просто варить, кушать, ходить. Единственное, работу не могла найти. Работу, потому что тут оказалось, опять же, зависело от родственников, потому что желание тебя отправить на работу у них опять также нет. И, в общем, короче, это опять препятствие. В результате я попала в закрытое учреждение, медицинское закрытое учреждение на пожизненное. Тут же, опять же, я вот это вот управление собственными эмоциями, управление своим внутренним балансом, каким-то сохранять себя эмоционально, беречь. И вот это вот помогло мне просто вжиться в этот коллектив, в эту сферу этого коллектива. Поэтому я стала, как бы, если сказать псевдо-трудотерапевт, то можно и это назвать. Если назвать псевдо-культ-организатор, то можно назвать и культ-организатором, потому что я писала и мониторинги, и занималась вот этими всеми людьми, которые имеют психическое расстройство. И использовала техники, которые, вот читала я там психиатрию, использовала техники, которые там есть. Я просто очень интересно увидела, что что оказывается те, которые, например, мы думаем совершенно вот так вот визуально не так, но когда мы в дело это вносим и проверяем ее на деле, она, оказывается, на самом деле работает. Поэтому, как бы, получается, я вот так я жила и росла, и, как бы, получается, вот отношения с социумом, у меня уже, как бы, если меня назовут психически больной, но у меня уже там, как бы, получается, не детонирует так, как вот до этого было. Те ощущения, которые, потому что мне его уже, получается, нет, я проработала его как бы внутренне. Если вообще-то в характере есть такое у меня, например, почему так, а как так, и так далее, и так далее. Я как бы пришла к тому, что даже я научилась защищаться перед родственником, даже при такой ситуации. Вот когда изучала, я тогда поняла, вот, например, психически больной, ему поставили диагноз, и он уже, как бы, получается, в статусе психического больного, он становится на учет, а когда уже становится на учет, тогда получается трудность в работе, что это будет зависеть опять, в зависимости от работодателя. Помимо, это получается уже три сферы, от которого ты зависишь. От их настроения, от их лобильности, от их желания и много всего сфер. И теперь получается так, что когда ты, это уже может быть, ты можешь работать столько, сколько даже те условия, которые они создают, они не подходят. То есть в том плане не то, чтобы они не подходят, они действительно не подходят, потому что сфера, в которой мы работаем, то получается вот этого нет. Вот. Ты постоянно находишься в зоне опасности. Тебе сегодня тебе будут хвалить, завтра тебе могут за эту же похвалу опять же по башке получить. И, в общем, это очень трудно. Но, тем не менее, жить можно. И, потому что девать некуда, мы же не можем убрать этот диагноз, не можем. И тогда я задумалась над тем, почему не снимают диагноз, почему не снимают инвалидность. Вот, например, инвалидность также ставилась, потому что, опять же, например, один врач считает, что инвалидность еще рано, а второй считает, что уже надо. А вот, например, те больные, которых я рассматривала, которые работают, которые могли и свой бизнес и так далее. Я тогда просто посмотрела, они, оказывается, вот, например, определенно 10, максимум 15 максимум прорабатывают, а потом уже идут опять на инвалидность. Потому что им делать больше нечего, потому что вот эта сфера, в которой они были, дальше они двигаться не могут, или это смещается, и кушать надо, жить надо, и получается, поэтому они вынуждены быть на инвалидность. А дальше уже, как бы, получается, опять же, зависит от вот тех людей,
Gulnara,
которые вот рядом
apologies.
с
If you
тобой. То есть,
can,
например, то окружение, которое родственники.
Gulnara, can you try to wrap it up now so that
Что
the others can also take the floor?
Да, хорошо, покороче. Мне просто тут как-то задали вопрос, что как снимается дееспособность. Для начала в Казахстане это назначается опекун для любого недееспособного. Недееспособный – это человек, который теряет полное право. А когда уже опекун подает заявление в суд, тогда уже рассматривается, и уже тогда приводится этот больной, и тогда уже рассматривается, снимать это или нет. Тогда назначается судмедэкспертиза, которая рассматривает, и уже по заключению судмедэкспертизы назначается снова суд, и вот этот суд рассматривает решение это и приводит к этому решению. Они выслушивают опекуна и опекунский совет, и самого человека. Но это, конечно, гораздо труднее. Но, тем не менее, это может большое количество времени взять, но, тем не менее, терпение и все остальное помогает. Это. Лоббирование интересов. Я надеюсь, я ответила на все, то есть в смысле по тематике, потому что я здесь немножко чуть-чуть пропустила из-за того, что перевод не сразу нашла, поэтому я прошу прощения, что не услышала, возможно, что-то не смогла ответить на ваши вопросы. Спасибо вам большое.
Thank you so much, dear Gulnara. I think you have given us a very rich food for thought. Among the very many important points you made, I think you said something that can become a mantra for any effort to improve mental health services when you said, when you are not free, you cannot make your own decisions. And there is no better argument in moving ahead the need to improve mental health services than this, because this is what people are striving for. It's freedom to make their own choices. And the way how you have experienced mental health services is that your basic freedoms were taken away. So thank you so much for this. And due to lack of time, I'm afraid we have to go to the next speaker now. I know that there are so many questions coming on the chat, questions and answers.
Хорошо.
We will try to
Спасибо.
provide some answers during today. If not, we'll try to engage with you in writing afterwards. So I have the pleasure now to give the floor to Regina Bisikiewicz, who represents the Polish Institute of Open Dialogue and who I had the tremendous pleasure to meet in person in Poland 18 months ago and witness firsthand the amazing job she is doing towards co-creation. The floor is yours, Regina.
Thank you. Okay, so I have really pleasure to introduce our experiences in co-creating, in changing the thinking and practice in Poland, using open dialogue and working with experts by experience. So first, let me present a family, Polish family, 2005. This family was living outside a very big city in a green area, family with 4 children, and spending holiday, sailing, climbing, going to the mountains. The parents were working in international company, so they were really happy ones. And one day, suddenly, one of the young persons in the family received the diagnosis, mental illness, and no green, no sun, but very big hospital, psychiatric hospital with bars on the windows and it was first episode, and this family was really very, very hopeful that time that it will be not appear. But 5 years later, 3 episodes, 3 hospitals, and together 7 months in hospitals. Could you believe what was the results of the treatment? Yeah, you might think the results were not really good because of isolation from the family of this young person, isolation from the society, anxiety about the future, loss of trust, broken relationships, taking away hope, and finally, the doctor's words, that's the way it is going to be. You have to live with it. It is a disease incurable. So help. This family, especially the parents, were screaming, "Who can help us? Who can help me?" was the voice of the mother. And she felt as being very, very deep, as you see on the screen. And the mother, as she was working all over the world in different companies, she thought, it is in 21st century, there must be a solution to help a person with mental disorder. I will find it. You know, this mother was me. Yes, it was me. And because I couldn't really stay with the situation, I started to travel, first within Poland and then outside. And what happened? I found it that in Western Lapland, Finland, within 30 years, schizophrenia decreased by 90%. 85% of patients after first episode returned to work, study, and so on. Where is Western Lapland? I was asking myself. Yes, it was very north to Europe. So, you know, for mother who wanted to help the beloved person, it was no barrier. So I came there for the Congress, and what I saw, new process. To me, it was completely new. Recovery. What does it mean? So recovery, it means the help comes very early, as at the beginning when the problem started. So for me, it was an exit from matrix, really. Why? Because open dialogue has had everything what we and what I needed in my family. So immediate help, inclusion of social network, flexibility, team responsibility, psychological community, tolerance of uncertainty, and finally dialogue. So dialogue where everyone's voice is considered. So for me, it was wow, really wow. So what more? Then wait a moment, I couldn't, yeah. So many questions appear. How it is possible, how to place it in Poland, who might be the trainers, who might be interested in training, who will finance this, and many, many, many other questions. So we founded a team. It was an international team. You see on the screen, Finland, Germany, Poland, Italy, yes, Jako Seikula, Werner Schütze, Roberto Messina, and from Poland, you see Anna Depuka, the head of the very big project. I will talk in a few moments. So what we discovered as a team going around Europe, that in the whole Europe, that talks about need to listen to people with affected with lived experience and their families. They gain a role of experts by experience. So what was next? Training, seminars, conferences, study visits, national and international projects. However, a few years later, 1915, we realized that enthusiasm for open dialogue was dying down. Why? What are we missing? So what we were missing was the link we have founded in Trieste. It was a community mental health center with prevention, treatment, social support. And the changes were done over years, many years ago. So we thought, we have solution for Poland. Why not to go there? We knocked the door to the Ministry of Health, Ministry of Funds, and they said, but, there are no specialists. We do not have community-based structure. We have no procedures. We don't have money, etc., etc. We said, stop. We families, of young people. We will not wait for years. The reform must be started now. Really, it was strong voice. So then we succeeded together through this international cooperation and the strong team, Polish team. We were involved in writing the National Mental Health Program for 4 years. Then we succeeded to convince the Minister of Funds to dedicate funds to the institutionalization of mental health and social support project. And we created in Poland by our team, the Community Mental Health Center with these components, pillars, as we have seen in Trieste. And you will not believe, but it is true. Altogether, EU funded projects on DI in Poland over the years were more than 100 million euro on country and regional levels. And the pilot of the Ministry of Health started a pilot of mental health centers. And today it's about 129 centers for more than 52% of Polish adult citizens. And the plan is to set up to 300 centers till 2028. And finally, the results so far indicate open dialogue and experts by experience were the spark which ignited the people. It provided an opportunity to start the change in thinking and practice in mental health on all levels. So our strength is co-creation, I am sure. Thank you.
Amazing, amazing, dear Regina. This is again a very big applaud to you, not only for the very wise words you said, but also for the passion and for the resilience you have shown as a citizen, as a mother, as a member of your community to impact and to be so impactful, not only on your small community in Wrocław that I had the honor to see with my eyes, but for the whole of Poland. So it's amazing what you have sparked in the country. And it's amazing also how you are bringing also the importance of international collaboration. You mentioned all those countries that were inspiring to you. And now I hope that the audience here today can get the same inspiration from you. So you are returning back to the community what you got from so many years ago. Without further ado, I have an executive decision to make because it's only half an hour before the end and we have so much more in the program. I would like to go to Gina Delaney from Mental Health Ireland to talk us through co-creation at the national level in Ireland. Gina, the floor is yours.
Thank you. So I will kick off. So thanks very much for having me. I'm delighted to be here. So I am a development officer with Mental Health Ireland, and the focus of our work is to promote and enhance mental health and well-being and to create an environment where we're all respected and supported, especially when our mental health is challenged. And what I like about that is that it really just humanizes the experience of mental health and of life challenges impacting on our mental health. So I suppose that's my work experiences with Mental Health Ireland as a development officer. We, as I said, we promote mental health. We also support the employment of lived experience into the workforce, which is really important in Ireland. And we also look to integrate service and community development with a focus on co-creation in our work as well, which I think is important to mention. That would be a strong part of the development officer's role. I also bring my own lived experience. My mother had a diagnosis. I don't really like labels or diagnosis, but sometimes it can be helpful when describing things. She had a diagnosis of schizophrenia. She was also a single parent, so that would have impacted on me a lot. And I got to experience co-creation with her, say at team level, at care planning, when it was right, when she wanted me to, and then also at local community level with our mental health forums, we call them, for service development, and then at national level. So looking at policy development frameworks, strategies, and that to support co-creation at national level, and that is of course my focus today. So to give a context, a definition that we use in our Mental Health Ireland strategy, so mental health for all, hope, strength and action. So co-production, as we call it, so co-production in Ireland is a strengths-based inclusive process that looks to incorporate the experience and expertise of people as equal participants from the very beginning and throughout the process, planning, development, delivery and evaluation of projects and services. So having all, I suppose, the right people around the table from the beginning and staying around the table all the way through, you know, implementation and through to evaluation. So I just wanted to, these, I suppose, are the visuals then of some of the policies and frameworks and strategies that are in place in Ireland that support us to bring that to life. So the larger one there on the screen is sharing the vision. So that's our national policy for mental health in Ireland. So that itself was co-produced. So it's the guiding mental health policy, and it was developed as through co-production process, and it's being implemented now through a co-production process also. And in the introduction to this, to the policy, our Minister for Mental Health says, it is essential that people with lived experience and their families are at the heart of mental health service design, development and delivery at all levels of the system. This will be achieved through effective and robust co-production structures and underpinned by principles of partnership, recovery and human rights. So the policy itself has co-production implicit in how the recommendations are recommended. And an example of that is, this I suppose is one of the recommendations within it, to ensure that inpatient services are appropriately funded and designed in co-production with all key stakeholders. So key stakeholders, I suppose, just meaning the right people around the table. Some more things there, I suppose, in the background, you can see the butterfly, that was a vision for change. So that was 2006, that was the predecessor for sharing the vision, which was the newer updated version in 2020. At the far right, you see partnership for change. So that is bringing about local forums for people to take part in co-creation. That's supported through a national office directly under the National Mental Health Services and within that. So that supports that process to happen. So from national into local, because that's where you see the changes happening, but then it must be supported by national. And over at the left-hand side, you see the National Framework for Recovery and Mental Health. And that has 4 principles written there underneath it. So lived experience, co-production, recovery education, and organisational commitment. So that's how we make sure that co-creation and recovery happen within the Irish context. One of the principles I said is co-production, and there's a separate guidance document to support services in implementing that. And then you see our strategy in Mental Health Ireland. And I suppose that the point of that there is to show that community and voluntary sector then will put these policies and frameworks into action through their own strategies then to make sure that they come to life within those. This wheel here, I suppose, symbolises the many areas of practice then. So, why, you know, to make sure that it happens at a national level, you have the policy that supports it, and then you have the practice then that that results in having that guiding policy. So I'm just going to pick a couple of highlights. I don't have time to go into all of those individually, but if you see in the pink area there, we have mental health forums, engagement leads, care and recovery plans. So just to highlight, I suppose, one area where co-creation can happen, and that is by having a national team to support engagement to happen at local level then, and to have supported area leads in place that will support that to happen. And I'll pick then the yellow, the orange colour, recovery colleges, peer educators, peer facilitators, Mental Health Ireland supports that through the employment. And this happens at a local level for everybody, for staff, for family members and for people using the services. So I suppose, look, I'm going to leave it there. There are challenges. Every time I say anything in my mind, I'm thinking of all the challenges as well. They come at individual level. Do we have the right, I suppose, skills, the right self-belief, the support, community and society level, can we grow beyond the mental health services? Service and systemic, we need to have the right culture, commitment and consistency, and to have capacity building at all times. So I'll stop there. I've already gone over, but thank you for listening, and hopefully that's been helpful.
Thank you. Thank you so very much, Gina. Thank you for sharing your own story. And like everybody else here, to share the story is the start. And I hope more people are going to step forward to share their own stories, because this is the most secure way of also addressing stigma and discrimination in mental health. But also, I'd like to add also a personal note. I had the honor to join the conference on sharing the vision in Ireland in January this year. And I was amazed to see how the National Implementation Committee for sharing the vision in Ireland is indeed led by the lived experience, which is a very, very strong signal, not only to the Irish community nationally, but to the rest of Europe and hopefully the world. So the points that come from Ireland are very loud and clear, and big thanks to the Irish mental health community for being so innovative and so energetic into doing things right. Thank you. Thank you, Gina. We now go to our next panelists, that are the young members, representing the young members of the Pan-European Mental Health Coalition, that is a WHO initiative. Dion Ras from Netherlands and Ines Sarmiento from Portugal are now taking the floor to tell us a bit about the youth co-creation within the Mental Health Coalition. The floor is yours, Dion and Ines.
Thank you, Lydia. Okay, so hello. As Lydia said, we are part of the Pan-European Mental Coalition, and we are experts by lived experience from countries representing the main WHO European regions. Please pass on to the second slide, Ian. Thank you. Together with other members that are not present here today, we co-created a document to help shape and improve the participation of young people in working with organizations. This document, as you can see, is named Youth Engaged for Mental Health, and it is a framework for youth participation under the WHO Pan-European Mental Health Coalition, and its strategies affect how youth participation is carried out. Jason is going to put the link for this document in the chat. Thank you. Dion, you can pass to the third slide. Thank you. So this framework has the following guiding principles: to be transparent, engaging, empowering, safe, supportive, and diverse. So inclusive and accessible. We also have a vision. You can pass on to the fourth slide. Thank you. So our vision is to have a meaningful, active, and impactful participation of youth that actually improve young people's mental health and well-being through changing the systems that youth have to navigate. It is very important for us to talk about things and processes, but also have impactful and sustainable action. I'm going to pass it on now to you, Dion.
Thank you so much, Ines. I will tell a little bit about the story behind the creation of this youth participation framework that Ines so wonderfully described just now. So this story starts actually in Athens, Greece, at the 2022 WHO Mental Health Week event. And at one particular workshop at this event, one about youth participation, a number of young attendees, including Ines and I, shared our worries about how our inputs into the workshop might be used in the future, and whether we would be communicated what the results of this workshop were. Now, this started a big discussion, and at some point during this discussion, I realized we needed some more time to discuss what we wanted our youth participation to look like. And so we, the young people, and the lovely WHO staff members Lydia Lazeri, Cassie Redlick, Jennifer Hall, and Jason Maurer agreed to meet at lunch. Now, at the end of this lunch meeting, we were asked to present a joint statement on youth participation at the next WHO meeting that would take place in Ankara, Turkey, which is a place where our story will continue. And I'd like to give the floor now to Ines.
Thank you, Dion. So in Ankara, a collective of youth from Athens presented the joint statement of youth participation. Some of the key points were that we wanted to represent young people and have an input in the processes, decisions, and the making of policies that affect us. Again, not all of us were able to be in Ankara, but we wanted to represent all, and it was a document co-produced by all of us that were in Athens. After this statement on the same day, we had a meeting with Natasha Azopardi-Muscat, Director Country Health Policies and Systems at World Health Organization. From this, we became consultants in developing the youth participation framework. Thank you. We took youth participation strategy to the next level with an in-person workshop we had in Denmark to further develop the youth participation framework. At that moment, all work had been happening was online, especially in the platform called Miro, proving that it is possible to work with young people in diverse ways by co-creating processes and organization. I'm going to give the floor back to you, Dion.
Thank you so much, Ines. Now, this all kind of culminated at the Youth Mental Health Day in Athens in 2023, where a year after we raised our concerns about youth participation, we launched the framework. And now, one full day at this multi-day event, we co-organized and we co-designed, including the activities that would take place and how the space would be used. We also co-facilitated discussions and gave presentations. So what was very amazing to see is that we had a very big role in how the event was organized, facilitated, designed, and led. Now, what Ines and I are very proud of is that we co-organized this day according to the principles laid out in our framework for youth participation that Ines mentioned. And it went very well, and the young people were very happy with how it was organized. So we were very proud of that. How about now? So what are we working on right now? Now, during this event that we co-organized, we gathered quite a lot of inputs and insights from young people, from scientists, from policymakers, and clinicians for the creation of a different guidance document on youth participation that will be used externally, so by organizations and governments, as opposed to internal use within the coalition, like the framework that we have been presenting about now. That different guidance document for external use is something that we're currently working on and also very proud of. Another thing that we are doing is sharing our framework with others, like we are doing right now. And with that, we have come to the end of our presentation. Thank you so much, everyone, for listening.
Thank you both, Dion and Ines. You've been consistently working together with us for all the things you mentioned. And what I'd like to say, I have said it other times, but also I want to say it now. When Ines mentioned that you became consultants, you and some other colleagues of yours became consultants for the World Health Organization, which was not an easy task, because in the World Health Organization, like in many other institutions, for one to become consultant, to have a contract, you need to have a lot of requirements. Basically, you need to have diplomas, etc. And some of the young people didn't have those diplomas because they are students. So we also had to apply some innovative approaches to get in touch and have an effective relationship with the young people, because as Zbigniew puts very eloquently in the chat, very often co-creation, for some people, co-creation means let's invite people with lived experience in the talk, and just the honor of having them around the table is big enough to afford not to pay them, which is not the case in co-creation actually. And so thank you to both of you and to the colleagues that were together with you in producing all the products you mentioned. We are now in a bit of a tight spot because we only have 13 minutes left, so we cannot go and move to the program as we had envisaged. But I would like to invite someone that has been patiently waiting to tell us a bit more from her experience in Kazakhstan, and that is Aygul, who is sitting with Gulnara in Astana, and who will tell us a bit of what kind of resources did she need to help Gulnara regaining her rights, and what resources, dear Aygul, you wish you had. If I can remind you, please don't take more than 4 minutes because we need to finish sharp on time. Over to you, Aygul.
Добрый день, спасибо большое. Меня слышно, да? Да, отлично. Извините, да, за вот такие поправки в вашей программе. И в том, что поддержка людей с ментальными нарушениями, она важна даже после восстановления дееспособности, поскольку мы с Гульнар живем в разных городах, и Гульнар нужна была техническая поддержка вот в части подключения даже к этой конференции. Поэтому это для нас тоже урок, как постоянно сопровождать, как делать политики, программы, которые помогают поддерживать этих людей даже после восстановления дееспособности. Но вопрос звучал о том, чтобы какие необходимы были ресурсы. Важно понимать, что, я думаю, на территории всей Центральной Азии существует устойчивая стигма и убеждение, что люди с психическими расстройствами и особенно с интеллектуальными, сочетанными нарушениями, они уже заведомо считаются недееспособными, и процедура лишения дееспособности – это некая такая формальная процедура, и статистика Верховного суда Республики Казахстан это и доказывает, что 99,9% заявлений суд удовлетворяется. И ресурсы были нужны в первую очередь, конечно, информационные, интеллектуальные ресурсы. Важно было понять положение гражданского законодательства и оживить его, поскольку эти статьи, они большей части не работают, хотя они прописаны в нашем законодательстве. Поэтому необходима была адвокация на уровне работы с врачами, судебно-психиатрическими экспертами, судьями, адвокатами, которые представляют интересы лиц, которые признаны судом недееспособными. И какие бы ресурсы помогли бы в будущем продолжать такие успешные практики восстановления дееспособности, это, пожалуй, массовое обучение, просвещение специалистов, в том числе судей и адвокатов. И в данном случае, поскольку я больше взаимодействую с Комитетом по правам людей с инвалидностью и знаю все их документы, заключительные замечания по статьям, но я хотела бы сказать, что документы Всемирной организации здравоохранения в теме прав людей с ментальными нарушениями, ментального здоровья, они содержат более точные рекомендации для государств. В частности, совместный документ ВОЗ и Управление Верховного комиссара по правам человека по психическому здоровью, правам человека и здоровью, который призывает изменить национальное законодательство в соответствии с положениями международных документов, оно очень подробное и лаконичное. И я думаю, что вот к вопросу о том, что побуждение к восстановлению и дееспособности всех остальных граждан в Казахстане недееспособных, я думаю, вот эти руководства очень помогут нам в работе. Спасибо.
Yeah. Thank you so much, Aygun, for your intervention. Thank you, first of all, for the great work you are doing in Kazakhstan and with your small organization helping people like Gulnara and beyond. And thank you also for this insight. It has been a pleasure to meet you last year in Tashkent in the policy dialogue for the Central Asian republics, and you continue to keep up with the good work. Thank you for that. We are very tight with time. I think now I will pass the floor to our partner, Stefan Schreck, who is here representing DG Sante of the European Commission, who has been mentioned several times today, and who I will also say a few words after about our collaboration at the end of the session. Stefan, the floor is yours.
Yes, thank you very much, Lydia. Yeah, this was very interesting. And to honor time, you will get the short version, let's say. I should just say mental health is a priority for the European Commission. We had the communication on a comprehensive approach to mental health adopted last June, and this has brought mental health under the spotlight in EU health policy. I should also not forget to mention that yesterday we adopted a tracking framework for the actions which have been planned under the Mental Health Initiative. I don't know, I can't put a link directly in the chat, but I answered a question already with a link so that you can see it, and it will be regularly updated so that you can see where we are with implementing the more than 20 actions under this framework. The Commission is taking a holistic approach based on three guiding principles. Firstly, there must be adequate and effective prevention for every EU citizen. Secondly, access to high quality and affordable mental health care and treatment should be possible for all. And lastly, reintegration into society for those recovering from mental health problems is key. This comprehensive approach is cross-sectoral in nature. It goes beyond health policy. It recognizes that mental health is influenced by many factors and that policies in areas other than health can positively affect mental well-being. And it's clear that collaboration is needed. Addressing mental health requires a co-creation approach involving partners at all levels. The initiative therefore calls upon national and regional actors, health and non-health policy sectors, patient organizations, and civil society organizations. These are key players in tackling mental health, and I'm proud to say that we are all working together for a common goal, the need to protect the rights of individuals with mental health conditions. It has been truly inspiring for me to listen to how co-creation in mental health has been applied in practice in Kazakhstan, Ireland, and Poland. The participation of young people in the Pan-European Mental Health Coalition is an excellent way of actively engaging young people in activities on mental health. These are all great examples of the power of co-creation in mental health. The Commission has pioneered the co-creation in the area of health at EU level with the design of the Healthier Together EU Non-Communicable Disease Initiative with its mental health strand. Let me also give you three examples that showcase how the Commission is ensuring co-creation in delivering on the flagships of the communication on mental health. Together with a team from WHO Europe, led by Lydia, we are supporting member states as they strengthen and reform their mental health systems. We just heard about how important that is. Through this European Mental Health Capacity Building Initiative, WHO will provide tailored support to EU countries based on their needs, challenges, and opportunities. We are also building capacity and supporting knowledge sharing through the recently launched EU ProMens program. This multidisciplinary training and exchange program will take place in 30 participating countries with an investment of 9 million euros. Through this program, we are fostering collaboration and promoting best practice among professionals working in various community settings. A key aspect of the program is co-creation with and inclusion of people with lived experience. I'm pleased that Mental Health Europe is part of a consortium leading the project. And children and young people in particular need our support. We will develop a prevention toolkit for a comprehensive prevention-oriented approach to children's health together with UNICEF. This will focus on addressing the links between mental and physical health and determinants. We will promote the participation of young people in the development of this toolkit. The role of stakeholders such as Mental Health Europe is vital in ensuring adequate mental health prevention and treatment in the fight against stigma. The Commission is supporting stakeholders in promoting mental health in communities. An example is the Mentality Project, which disseminates promising practices in mental health care. This focuses on vulnerable groups, including children and young people living in deprived areas and migrant and refugee populations. Yes, so you see the collective approach is really a key in a strong European health union. And together we can build a Europe where mental health is a priority and everyone has the support they need to live their best lives. Yes, and before I end, I would like to mention again the tracking framework where you can see where we are with implementing this initiative. Thank you very much.
Thank you so very much, Stefan, for this very rich information. And I think it comes at a time when everybody realizes that in a very unprecedented way, the Commission and WHO are paying attention to mental health, are prioritizing mental health, and investing, are bumping up actions with member states and beyond. So this brings me to then my closing remarks. You mentioned, Stefan, that we are working together in the implementation of especially Initiative 1, the flagship Initiative 1 of the comprehensive approach. And within this, we are working with all the member states of the European Union into addressing what we call mental health challenges. And part of that collaboration is also what we call professionalization of lived experience, which is in a way to say that co-creation not only should happen everywhere, but it should be also a part of a regularized part of mental health service delivery, where the lived experience is recognized as expertise and is also compensated as such. And in that effort, we are working together with the Mental Health Europe. Catherine Brogan is one of our partners into developing that toolkit that we are doing together in frame of the collaborative agreement with the European Commission. Another moment I would like to bring is also the work we are doing in WHO in addressing stigma and discrimination in mental health. Some members of our working group here, like Zbigniew, are here, and we to witness how we are developing a toolkit to address stigma and discrimination that should be at the hands of all those who want to develop anti-stigma programs in their countries, be those government representatives, be those NGOs representatives, or individual people. And that we will present next week in Brussels. We will have cross-learning workshop between the Pan-European Mental Health Coalition of WHO and the Joint Action Implemental of the European Union, where experts and people with lived experience and government representatives will have a chance to cross-learn from each other, to learn from successes, and to also draw some lessons from where things haven't gone well. So in case you have not heard about that session, you will find the announcement about the Brussels meeting in our social media channels and in the WHO website. And we hope you can join us through the web stream, and those who have been invited can join us to contribute to the series of those products that we can do together. And last but not least, it goes with a great appreciation the number of questions we have have had in the chat. Naturally, those questions are not only numerous, but also very, very good, and that would require a very thorough answer. And we realize that those questions cannot be answered by emails that we can send here and there to the people who ask the questions. So we are starting to discuss already how we can have follow-up webinars on focused on the questions that we have received. And in order to solidify your demand and your need, we are now giving you another poll that is about, that is about what else would you like to learn, so that we can capture your desires, your demands, and we can shape the next session, the next series of webinars around these themes. It seems we have touched a nerve. Thank you so much, UFA, for prioritizing mental health. Thank you so much, Mental Health Europe, for always being in the avant-garde of mental health actions in Europe. Thank you so much, European Commission, for truly and authentically supporting mental health in Europe. And thank you very much to Jason and the WHO team for making sure this session happened. We will meet again. This is not the last, this is just the beginning. And all of you who have been with us today, either as panelists or as participants, are greatly appreciated, and will continue to engage with you for giving more answers to co-creation and making co-creation a reality in Europe. And with this, I have the tremendous pleasure to close this with appreciation and recognition to the hard work of all. Thank you.